So this is the Veress needle. It is available in 3 sizes: 12 centimeter, 10 centimeter and 8 centimeter. 12 is for the obese abdominal wall and 8 is for the thin ladies. So the parts, this is the outer one. The outer one has a hollow and the tip has a sharp beveled edge. You can see this sharp beveled edge. This is the outer hollow needle. The inner one has a spring here. This is called the obturator with a subterminal opening. You can see the opening here through which the pneumoperitoneum can be created. So this is when you put this in this direction, that means it is open. When you turn it around this way, that means it is closed. So this is the open one which is perpendicular, and here is a hub where you can attach a needle or the carbon dioxide gas is attached to this hub. So now let's assemble this. Thank you. Assembled it, the outer hollow one with a sharp edge, and then the inner one has a blunt end with a terminal opening. We'll check for the spring action. Yes. So when you pierce the abdominal wall, because of the spring action, immediately the sharp end goes back and the blunt end comes forward, so that the injuries to the underlying structures are prevented. So how do we know that we have entered the peritoneal cavity safely? So there is a double click test. That is, when we pierce the rectus sheath, we appreciate one click, and the second click we appreciate when we pierce the peritoneum. That's called the double click test. Then second is the aspiration test. 5 ml of saline is taken and you attach to the hub and you inject it. There will be a free flow of saline, and when you aspirate, you will not be able to aspirate if the Veress needle is placed successfully in the peritoneal cavity. Say suppose you aspirate blood, that means you have injured a vessel. Say suppose you are aspirating yellowish fluid, that means you have perforated the bowel. So that's the importance of the aspiration test. The third test would be hanging drop test. You just leave a drop of saline over the hub, and when you lift the abdominal wall, because of the negative pressure, the drop gets sucked in. So that is another test which tells us that we have placed the needle inside the peritoneal cavity. And the best test is the negative pressure or low pressure. When the monitor is showing a less pressure or negative pressure less than 10 mm of mercury, that is the sure test which says that the needle has been placed successfully intraperitoneal. Thank you. Instrument is called Trocar. It's a sharp instrument and you can see a pyramidal tip. There are various types of tips. One is pyramidal, then there is conical, we have optical and also blunt. But what I am demonstrating here is pyramidal. It is very sharp when compared to others. The advantage of optical axis is it will guide us so that we will not go into a wrong entry. The disadvantage of the sharp is you will have to have a very good control, otherwise the injuries are likely. Now coming to the parts of this trocar, we have, this is the outer sleeve or the canula. This is the outer sleeve and the canula, and there is a provision for the connecting the gas, that is carbon dioxide, and this is the open valve and this is a closed valve, and it has a rubber sleeve or a stopper here on the top. And this is the inner one. The inner one has a sharp pyramidal edge, and this is how it is assembled. And we have different sizes And if you can closely observe, the outer one has two holes. This is to allow the carbon dioxide to escape. So we have different sizes here. This is a 5 mm Trocar sleeve, and this is 7 mm used for double puncture laparoscopic sterilization. And then this is the 10 mm for other operative procedures. It is held against the thenar eminence, and the whole of the instrument is grasped this way, and the index finger acts as a guide. The abdomen has to be lifted up after creating the pneumoperitoneum, and it is inserted at 45-degree angle. If the woman is obese, it is inserted vertically. And then as soon as you feel that there is a loss of resistance, and always keep this valve open so that the carbon dioxide escapes, and that at that point of time you just stop and withdraw the sharp end, and then the blunt end is positioned in such a way that it goes towards the pelvis or the hollow of the sacrum, and through these apertures the carbon dioxide gas enters the peritoneal cavity. Thank you. This is a telescope. This is narrower one is the 5 mm, and this is the 10 mm telescope. It has three parts. This is the eyepiece to which the head of the camera is fitted, and then we have one port where the light source is connected, the xenon light source, and then we have a shaft, and then we have the after the eyepiece, the shaft, and we have the lens, the objective lens. And here we have two types, 0-degree and 30-degree optical lens. Here we can see it is 30-degree because it is not straight. It has a oblique bevel type of shape, and this is corresponding to 30-degree. We can see the shape, it's beveled. So this is again 30-degree. So the advantage of the 0-degree is we get a panoramic view. When we use a 30-degree, the focally we can visualize the object or the septum or the polyp. All the procedures can be done very easily because it gives a very good point of vision when compared to a panoramic view. So most of the time 30-degree optical lens is preferred over 0-degree. Thank you. This is suction irrigation cannula. We have in two sizes, 5 mm and 10 mm. This is 5 mm, and if you can closely observe, there are multiple apertures over the distal end, and we'll have to push this button down and then bring it to the neutral position so that the fluid gets aspirated. Even when there is a large ovarian cyst, we just pass this cannula into the cyst and we try to aspirate. So even in ectopic pregnancies, when there is rupture, the hemoperitoneum, generally 10 mm is preferred when there is a hemoperitoneum. So this is a suction cannula. Thank you. The various kinds of graspers. To start with, this is the Maryland. If you can see, it is a little curved and beaked like this, non-tooth. Maryland used for holding the tissues and dissection especially. This is the Maryland forceps, and this is the second common most used instrument, which is a non-tooth grasper. So it's atraumatic and non-tooth grasper. And you can also see another one here. It is a Babcock's forceps, similar to the regular Babcock's but very tiny in size. And this is the Babcock's. Fallopian tube ureter can be held with this. And this is the bowel grasper. It is almost mimicking the non-tooth grasper, but the arms are little longer. So bowel grasper, non-tooth grasper, the Babcock's, the Maryland, which is little slightly curved, used for dissection, and this is the tooth grasper. So we'll have to be really careful when holding the tissues, but the grip is very firm because of its teeth provision. Thank you. This is a myoma screw. It is drilled into the uterus. Even when there is no myoma, it is drilled so that you can hold the uterus and just give a little traction to the right and left. This is the myoma screw, and this is the needle. This needle is used for injecting vasopressin. Fine tip is there, and this is the needle. Thank you. This is the bipolar forceps. You can see the two arms like this. The current passes through one of the limb, then through the tissue, and comes out through the same instrument and then passes to the electrosurgical unit. The purpose of this instrument is to coagulate the tissues. But if you have to cut the tissue, again you'll have to remove this instrument, insert the scissors through which a unipolar or monopolar current is attached. Single knob like structure is seen, and you cut the tissue with the scissors. There's another improvement and advancement where this is 2-in-1, where you can coagulate with this forceps, and here you have an attachment for bipolar source, and through the bipolar you can also coagulate and cut the tissue. So need not remove this instrument. This is a 2-in-1 coagulation and for sealer and cutter. Thank you. Monopolar forceps, electrosurgical units. See, in the top you have a single knob like thing. This is the spatula. Generally it is used for opening the UV fold of peritoneum, and also sometimes it is also used for opening the vault. This is spatula, little broader. So another monopolar instrument. This is the connection where we give the monopolar current, and this is the L hook. Again the same purpose for dissecting the UV fold or even for the opening of the vault. Thank you. This is a uterine manipulator made of steel. So this is introduced, and then with the handle you can just antivert, retrovert, and then displace the uterus to right, left, and you can also visualize the pouch of Douglas. We have another uterine manipulator with the colpotometer cups. These are the various cups, colpotomizer cups, large, medium, depending on the parity of the woman, the size of the cup is selected. And this is placed in the vagina so that the gas does not escape at the end of opening of the vault. Thank you. This is the vaginal tube. It's made of silicone, and this end goes into the vagina, and through this end we pass one instrument, and the cut uterus, the specimen after it is cut, the cervix is negotiated through this end, and through an instrument we try to pull the uterus out. And once the colpotomy is done and the vault is open, the gas carbon dioxide tries to escape. So we seal this end with a mop. Thank you. This is the ring applicator used for performing laparoscopic sterilization. So the silastic rings are loaded here in this groove, and then with a downward movement the tongs come out. The ischemic portion of the fallopian tube is held, and the tongs are pulled up and the rings are delivered. So this is the ring applicator, which is 7 mm in diameter. Thank you. This is an advanced bipolar system where this is called as a ligature, and the diameter is 5 mm. The length of the instrument is 37 mm. Here the high cooperative pressures up to a temperature of 100 degrees is released, and then that causes denature of the collagen elastic and forms a seal. The tensile strength of that seal would be 3 times that of the systolic blood pressure. And when you activate this, the seal happens, and finally a small blade comes out and then it cuts. So it coagulates and also cuts the tissue, and it uses ultrasonic energy and the bipolar, and it can seal up to 7 mm diameter of the vessel. Thank you. This is a needle holder. This is a straight type of needle holder. We have another one which is a curved type, little of curvature when compared to this. This is another needle holder, and this is the clip applicator which is used to apply clip to the uterine vessels at its origin. Thank you. Hysteroscopic instruments. This is the resectoscope. It has an outer sheath and an inner sheath. If you closely look, the outer sheath has perforations so that the fluid enters the uterine cavity, and it is oblique. So this is 30-degree optical lens, and the outer sheath has the outflow port. The inner one, the inner sheath is this one. Here we see the inflow, the fluid inflow, the distending medium here, and this is for the passage of the telescope, and here the ancillary instruments, the instruments are passed through this. So here we have the biopsy forceps. Here this is the delicate biopsy forceps. If we have a polyp, then we have to negotiate this instrument, and it has a protective rubber sheet on the top. Through this the instrument is passed, and the distance between the outer and the inner sheath is around 1 mm. That facilitates the fluid to pass in. So this is how the instruments are passed to the through this port. And this is the scissors to cut the adhesions and also the polyp. So you can see one limb is only actively moving. This is the scissors, hysteroscopic scissors, and this is the monopolar device, Veress point, and this is used to cut the septum. But when compared to the monopolar current, scissors is preferred instrument because does not use any electrosurgical unit, any energy sources. So the adhesions, the risk, even if there is a perforation, the dangers are less. So instead of the monopolar, the preferred instrument would be scissors in cutting the septum or the adhesions. Thank you. This is a formalin chamber where at least 10 tablets of formalin wrapped in a gauze is kept at the bottom. And we can see in this box the light cable, the carbon dioxide tubing, and the camera with the tubing is placed in this. So most of them are like plastic ones, are sterilized in the formalin chamber. You can see 3 items in this: the light cable, the carbon dioxide connector tube, which is a silicone made, and the camera. You can see the camera and with the cable attached to it. These are the only instruments which are kept in a formalin chamber. Thank you. Telescopes are mainly sterilized by soaking for 10 hours in 2% glutaraldehyde, that is Sidex. And it's important to use steel made rather than the plastic made material for storing and sterilizing telescopes. So date of activation, date of expiry is close to 2 weeks. This has to be mentioned on the top, and this is the glutaraldehyde and 2% Sidex, mainly for sterilization of the telescopes which are soaked overnight for 10 hours. If you soak it only for 20 minutes, then it is high level disinfection, and 4 hours only the spores can be successfully killed. Thank you. High level disinfection can be also obtained by immersing the instruments in boiling water at 100 degrees centigrade by immersing the instruments for nearly 20 minutes in this boiling water, and the instruments have to be placed in an open fashion and then left, and all the instruments should be immersed. The ideal way of sterilizing the steel instruments is autoclave, but high level disinfection is also permitted by immersing the instrument for 20 minutes in bubbling boiled water, which is equivalent to 100 degrees, and fully immersed in an open fashion like this. Thank you.